A while back, I tested positive for COVID-19. It happened, and the first thing that runs through your mind is, I can't get any of my family sick. And that was um, an even bigger deal for us because I knew that I lived in a immunocompromised home. Um, some of us have pre-existing conditions that make our immune systems um, weaker, and so that had been the the issue all along when this pandemic broke out back in March. Is we can't get this thing because it's going to mean a whole world of trouble for us. And so that's what goes through your mind when you test positive for COVID 19. You're not thinking so much about yourself. You're thinking about, how do I keep my family safe and healthy, and how do I keep this thing from them? Um, so I went into isolation. As I speak now, we are winding down on day 11 of total isolation. My existence in our apartment has been staying in this one room. And then everything else is because, I don't have a government helicopter picking me up in my front yard and taking me to the hospital where I'm the boss and I govern over the doctors. I don't have experimental hormones and what was it, steroids that they gave him. And I'm not a Chris Cuomo where I can go into a finished basement with my own bathroom and hide out for 14 days, 20 days. I don't have all those things. We live in an apartment with one bathroom. So the game becomes, how do I touch the least amount of surfaces possible when I need to use the bathroom, so I don't get my family sick. And I've been staying in this bedroom. I can only be in this bedroom uh, or the bathroom. That's it. I can't exist anywhere else. Um, Kadla can't come in here, and she's got to. We're down to the point where she has to do everything for me. She's got to make the food, put it on a stool outside my door. I gotta wait till she leaves. Then I gotta open the door, pick up the food, bring it into the bedroom, shut the door. I have to wear a mask at all times when I leave the room to go to the bathroom. Um, I gotta wear gloves at all times. I'm even She doesn't know this, but I even try to hold my breath, even with the mask on, just so I'm eliminating chances. Everything's about eliminating chances and touching the least amount of surfaces possible and affecting the environment as little as possible. Um, so it's scary. Thankfully, my wife has not tested positive. She's tested twice since I went into isolation. Um, that is one thing I will say. I wish I did better. We still skated through this um, well enough, but the first time I got any symptoms, it was congestion in one of my sinuses, and that's enough of a symptom where I wish I had isolated right then and there. But you tell yourself it could be allergies, it could be even just a cold that I got, because we live a very careful lifestyle with this pandemic. The whole time since March, it's just been me and Kadla staying home, and we wear masks everywhere we go. We wear proper masks. We don't wear bandanas; those don't work. Uh, we never have the mask under our nose, under our chin. That's not how we play this. We play this serious, and we wear our masks everywhere. Every time we only go to get groceries, things that we need, and when we get back in the car, we sanitize our hands. We have hand sanitizer in the car waiting for us. Every time we come back home, we change into different clothes. We leave our shoes at the door. We wash our hands. Um, So we've been doing that the whole time. But somebody, there's been a number of situations where we've run into somebody who didn't want to wear a mask. And I don't know, the most unsettling thing is I don't know what moment I caught the virus. Um, Especially when I know that I'm a stickler for the mask. Um, we're not sure how I got it, and that does things to you. You know, you're trying your best to take precautions seriously and trying to keep other people safe. And somebody got me. Somebody, one of those times, one of those many times where somebody at the store didn't want to wear a mask and they're causing a ruckus, or somebody had their mask pulled down under their nose. Um, it could have been any one of those moments, and our whole building got it too. All of our neighbors are coughing. You can hear them in the bedrooms, through the walls. We all got it at the same time too, so there's something there. But I don't know how I got it. But I'm on day 11 of isolation. Tomorrow morning, I go and I'm going to get tested at one of the free sites that the county has open. And what I'm trying to do is I have a test scheduled for tomorrow morning and then a test scheduled for the following morning, because I was reading a paper that came out of Harvard saying that if you want to know if you're contagious or not, after you know you've had the virus and you've had symptoms, what you need to do, the most scientific thing that you can do, is test twice, 24 hours apart, and be negative on both tests without medications, having no fever. If you can do that, then, and your symptoms are getting at least better, if not gone entirely, chances are you're not contagious any longer. And for our household being immunocompromised, that's super important that I know I'm not contagious when I come out of this room next. Um, Going back to when I was when I tested positive, you go to the CDC website. The CDC tells you need to talk to your healthcare provider. When I got the email from the place where I tested, they too said you need to call your healthcare provider and let them know that you've tested positive for COVID-19. So I call. It happened to be on the weekend, and my doctor, my regular doctor, can't be reached, and I still haven't talked to my regular doctor. But they asked me, "Do you want to talk to another doctor same day?" And I said yes. So they said in a few hours, this doctor will give you a call. So she calls me, and she kind of has this attitude. It's, I guess, I can't be too hard on healthcare workers right now because they're being run ragged with this pandemic. But she's basically like, "Yeah, what do you want?" And I said, "Well, I tested positive for COVID-19. My wife has a pre-existing condition." I told her what that was, and she was kind of still like, "So what do you want me to say to you?" And I had to explain, well, I was told by two different sources to call my healthcare provider, and this is me doing that. And I would like to know what my next steps are. How do I stay safe? How do I keep my family safe? Um, what do you recommend for isolation? I'm in isolation right now, but I need to know how many days I need to be in isolation. And she gave me this kind of dismissive, lackluster, well, just count 10 days away from when you first felt symptoms. And once you hit 10 days, discontinue your isolation. And I said, well, don't you even want to know how I'm feeling, like what symptoms I have? She didn't even ask me that before she gave me that advice. I could have been coughing up a storm, and she would have still told me, just count 10 days. Um, she wasn't asking me if I had loss of breath, if I she wasn't asking me anything about my condition. She wasn't trying to figure out, do I need to go to the hospital? I was coughing when I was talking to her on the phone, um, and she didn't have much of a concern about any of that. Um, so I kind of pressed a little bit, and I said, "Well, that seems to be a little. Everyone experiences this differently, and we're an immunocompromised house. How can I be sure that I'm safe? You know, and that I'm quarantining properly and for the proper amount of time?" And she said, "Well, if you want to be extra sure, then then instead count 10 days from when you tested positive, from when you took that test, and after 10 days have passed, then just discontinue your isolation. Just live normal after that." And there again, I was kind of like, man, I don't know. And so I kept remembering 14 days, 14-day isolation, from when different well-known figures contracted the virus. I remember a lot of people were talking about that from the CDC. So um, I took it further and I counted 14 days from the positive test date. And that's when I am going to discontinue this. Well, as long as my symptoms are improving and or they're gone, and my sinus congestion is gone 100%. It's been gone for days. I only cough once in a great while, like, maybe I'll cough twice in a day in a 24-hour period now, whereas I was coughing a lot more before. um, I feel better. I do feel like sometimes my lungs are a little constrained, but they say that that's just how life is after COVID-19 for an undetermined period of time. Some people recover fully. Some people, we don't know when they're going to breathe normal again. This thing stays with you. Um, so that's pretty scary. Um, I don't know what this is going to mean for the rest of my life. So those are the things I'm going through. Day 11. Tomorrow's my first test. Hopefully I get a negative result from that. And then I take a test the following morning, like I said. Hopefully I get 2 negative results. And then I'll know that I'm not contagious. I know my symptoms have lessened. Um, they're almost gone. Just a little bit of constriction on my lungs, or a sensation of restriction, I should say. I have a little cough here and there. But that's where I'm at, everyone. Um, One thing I would say is, yes, I'm going to go back to wearing a mask. I'm going to try to limit going out even more. No, I'm not going to be visiting family, not for holidays, um, not for anything. Maybe dropping off food, contactless, and that's it. But we're going to stick to only getting provisions, and that's it. Other than that, I'm going to be monitoring my health, and if I ever have symptoms, I'm going to go into isolation immediately. Then figure out how to go get tested. When's the next time I can get tested? Set up an appointment for that. Another thing is, I'm definitely going to. I didn't get a chance to get the flu shot yet, so our household is going to get the flu shot at the same time. Um, we're monitoring when the vaccines come out for COVID-19. We're going to get that. Got to keep my family safe. It is about other people. Every time I hear somebody saying that they don't want to wear masks, they don't want to live in fear, I notice that they're always talking about themselves and their own decisions over their bodies. The thing is you have to react to this. You have to plan this out based on how you affect others. I don't want to make a healthcare decision for other people. I don't want them just to get it and get it over with. That doesn't work. You can get COVID-19 a second time anyways. I'm going to wear my mask properly over my nose and mouth, and it's going to be a proper mask. all the time. I'm going to stay 8 feet away from people. None of this 6 feet business, 8 feet from me, because I care about other people. And I don't want them having to even wonder if they're going to get something from me. Nobody's going to see how I'm acting and wonder, is this guy taking it serious? I've got people back home that I'm trying to keep safe. Is this guy taking it serious? Nobody's going to wonder that from me in the grocery stores. They're going to see that I'm keeping distance. I'm wearing a mask. I'm wearing gloves. Um, they're going to know that I'm taking it serious. They don't have to wonder if they're getting anything from me. You're not getting nothing from me. Um, Stay safe out there. If you feel symptoms, please isolate immediately. If it's just hay fever or something, if it's just allergies, then it'll pass. No harm, no foul. You did the best you could. That's great. Um, Isolate immediately if you have a cough, if you're sneezing, if you have congestion. Um, these things are serious. If you're vomiting, isolate immediately. Then figure out how you're going to take the test and see if you're positive or negative. Be safe out there. I'll try to keep everyone updated on how I'm doing and what it's like. Thank goodness my symptoms have been mild. I've been lucky. I bless everyone out there. Stay safe.